So for my assessment binder, I have adapted the CASELS assessment that we do. It's an informal assessment in which it has different criterion and target behaviors that we just monitor and see at what level the students develop each criteria and target behavior, and when they do, we determine if they're emerging, mastering, or generalized. And so since we use that assessment quite often in our classroom, I decided to use that for my assessment binder. So I adapted some of the target behaviors and picked the ones that were most important that I felt that my students would really show as far as developmental, where they are and how they're improving. And so the different categories I have are social, emotional development, classroom table time, motor skills, reading readiness, and listening skills. So I just have this monthly progress update in which I fill out each of these criterion based on how they're doing and jot down comments. So for example, Nora, we've had her since almost the beginning of the school year, and so she started off, I started at the beginning of the semester, so she started off with a lot of emerging, mastering, a few generalized, and so I just kind of ran through here and decided at the end of February, March, April, I would do another assessment. And so she started off kind of struggling in the biggest part that she was lacking in was the reading readiness. That and then the table time, she just had a couple behavioral things like sitting in her chair. But as far as learning targets, the reading readiness, so things about like answering the questions about the story where she wasn't quite getting the comprehension. So we had been working on answering questions, comprehension questions throughout a read aloud as we worked with her. So things like at the end of a page or two, we would ask her a question, now what happened, and then revisit that question at the end of the story to see if she was in fact retaining that information. So yeah, and then the other student that I did was Matthias. He is our newest student, and when he came in, he didn't have much of a birth to 3 experience. So when he came in, it was wonderful to see him improve even from day to day. And he came in with little